NPTE StudyCast.
All right, welcome to NPTE StudyCast, talking about Huntington's disease. Bridget, this one's pretty scary. So what does it look like?
Huntington's is an inherited autosomal dominant trait that causes degeneration that's specific to certain brain regions. So there's actually a Huntington's disease gene that's located on chromosome 4. That gene produces the Huntington protein that's found in cells throughout the body.
Signs and symptoms.
So the symptoms can present at any age. The symptoms include physical, cognitive, and actually psychiatric signs and symptoms. And the disease itself is clinically divided into stages, 5 stages: preclinical, early, middle, late, and end of life stages.
Anatomy.
You mentioned some of the anatomy, but what are some of the things that it actually looks like? How does a patient present?
The mechanism is actually unclear, but the hallmark sign is atrophy of the striatum that later involves the cerebral cortex and subcortical structures. So this causes a severe loss of neurons in the caudate and the putamen, but it also affects the basal ganglia pathways, and it affects the indirect pathway before the direct pathway, which is probably one of the more important things to know for the exam.
Differential diagnosis.
So what else could it be, differential diagnosis?
A lot of the differential diagnoses that come up with Huntington's are varied. It could be lupus, chorea, which is that uncontrolled movement, ataxia. It could just be a generalized neurodevelopmental disorder, tardive dyskinesia, but all of these would be ruled out with genetic testing.
Treatment examples.
Now, what does a physical therapist do about it when you're working with someone with Huntington's?
PT, a lot of times, are just going to be seeing these people in kind of the middle and later stages of the disease progression. One of the big things is to check the medications that they're on. These patients are usually prescribed medications to address the abnormal movements, as well as the psychiatric disorders. So you want to make sure that they're actually on some of those. And then 95% of Huntington's disease patients are seen by the PT in the middle or late phase of the disease progression. So a lot of the PT management is specific to that individual and the phase of their disease. So it might be, getting the appropriate DME, making sure that family education or training has been done, things like that, because the key treatment goal at that point is usually management of falls and management of decreased mobility.
Got it.
Here's your example question.
Now, how will we see this on the NPTE, you think?
This is one where meds is going to be a little bit more important because it really drastically changes somebody's function. So knowing some of the common meds that they're on, but then also just the PT management of the disease progression. So they might incorporate this disease into a question that's more about like DME needs or family training and education.
That's it. That's all we need to know for Huntington's disease on the NPTE.
That's right.
NPTE StudyCast. Brewed by the PT Pintcast.